Hello ladies, introducing SmartFem Entertainment, the go-to resource for you, the busy woman on the go. Lots to do. So be a smart female and check out SmartFem Entertainment. We feature real women and their stories, the kind you want to see. SmartFem Entertainment, online, on air, everywhere. Plastic surgery is big business here in the Valley of the Sun, especially breast augmentation. But are women doing their due diligence before undergoing the knife? We decided to find out.
Thanks, Leah. I'm Chantel here with SmartFem Street Talk, and today I've taken to the streets to talk to some ladies about their thoughts on plastic surgery. So first off, do you know the difference between cosmetic surgery and plastic surgery?
I do not. I always thought they were the same, so they are different. I did not know that. I'm assuming maybe they have a difference in their schooling or something like that, or technique. I'm not really sure.
Well, plastic surgery, I'm assuming, is where you're actually making physical changes to the body, whereas cosmetic surgery might be minor things that you're doing to maybe like make your face look better or something like that.
Plastic surgeon would be all about your body. A cosmetic surgeon would be all about your face.
Excellent. Do you know which one would require more schooling?
I would think the plastic surgeon because there's more body.
So I'm back here with celebrity plastic surgeon Dr. Rick Brown. Now, Dr. Rick, we were out on the streets talking to several women about their thoughts on breast augmentation, and clearly a lot of mixed information going on out there. So can you give our viewers 5 tips if they're considering a breast augmentation surgery?
Yeah, there's lots of things to think about. I think the most important thing is you want to choose a board-certified plastic surgeon, and we've talked about that a little bit before. What that means is that we've been deemed by our peers and colleagues by taking a written and oral examination to be competent to perform all of the cosmetic and reconstructive procedures. So that's the first thing that's important, I think, when they're looking for a surgeon. Board-certified plastic surgeon is someone who's gone through the process of becoming certified versus someone who is a, quote, cosmetic surgeon. They did not necessarily go through all of the training for plastic and reconstructive surgery. They may have gone and taken a weekend course on specific procedures.
Wait a second, Dr. Rick. A weekend course? A weekend course?
Believe it or not, a lot of people have. Now, not everyone has, but yeah, a lot of people do. They just go and learn how to do liposuction or how to do a breast augmentation, and somehow that's legal in many states.
Ladies, you definitely want a plastic surgeon. Thank you for that.
I think the second thing that's important is that you make a connection with your surgeon. There couldn't be anything more important than that, in my opinion, because whoever you choose, you want to have trust in that person. The third thing I think that's really important is that you have realistic expectations. Some patients aren't really sure what they want, or they think that what they want is possible and it's not. So I think having realistic expectations is very important.
How does a woman know? How big is too big?
It's very simple. And if your plastic surgeon knows what they're doing, it's very simple. Pretend that you're buying shoes, okay? If you're a size 6 shoe, you're gonna not buy a size 10 shoe, right?
Right.
Well, when I measure the woman's breast, I measure the width of their breast. And if the width of their breast is 10 centimeters, I would never pick an implant that's 15 centimeters. Another thing that's important would be to look for before and after pictures from the surgeon that you are gonna choose. I think that's something that's really important to see someone's work, and if they don't have work to show you, that's something that would worry me a little bit. A fifth thing is just to make sure you listen to everything your surgeon tells you if you trust them, because recovery is really important, and when patients don't do what they're supposed to do, sometimes that affects the results, so I think that's really important.
Great. Now, a lot of women out there don't know if you can breastfeed after a breast augmentation surgery. Is that something that is possible?
Yeah, that's a great question. There really should not be any effect. When we talk about breast augmentation surgery in the consultation, we discuss placing the implant above versus below the breast tissue or the muscle. When you go under the muscle, there's really no interruption to the breast duct, so there should not be any effect on breastfeeding. For patients that have implants placed above the muscle, you can injure the milk ducts. It's very rare to do that, but if you have an experienced surgeon that knows what they're doing, it shouldn't be an issue. But the surgery itself, it's very low risk and shouldn't cause much of a problem with breastfeeding.
Now, do you have any idea how long breast implants last for?
I would have no idea, maybe 5 years.
Maybe 10 or 15 years.
Now, is there a shelf life for breast augmentation? How long do they normally last?
Yeah, I get this question a lot. You know, there's no true shelf life to an implant. Being that said, they're man-made devices. They do deteriorate with time. People used to talk about every 10 years I have to have them replaced, and that's not necessarily true. If you don't have a problem with an implant, you don't have to do anything. But at some point in the course of 15, 20, 30 years, you're probably going to have your implant replaced if you've had it that long, because they do start to deteriorate with time.
Wonderful. Well, thank you very much. I hope that cleared up some of the information for you ladies out there. With SmartFem Entertainment, I'm Chantel.
My mother has had breast augmentation. At first I didn't understand it. I was really young, but as I got older and once I had conversations with her now as an adult, I get it. Like, she had a lot of physical issues that made her breasts look not normal, and so that's why she really wanted to do it. So I think she really did it for herself and not for, you know, somebody else.
All of these implants are very good implants. The one that we choose for you is really based on a clinical examination. I try to determine what's the best implant for you, and then at the end of the day, we pick the one that's going to give you the best result. Thank you very much.
Wow, great information. I hope women will do their due diligence before undergoing the knife. Thanks for watching, and for the extended version, be sure to check out smartfem.com. I'm Lea Woodford, your host, and this has been SmartFem Entertainment TV.
Hello ladies, introducing SmartFem Entertainment, the go-to resource for you, the busy woman on the go. Lots to do. So be a smart female and check out SmartFem Entertainment. We feature real women and their stories, the kind you want to see. SmartFem Entertainment, online, on air, everywhere.